Hello everybody, and welcome to this week's edition of Dr. Pam's Video Clips. And before I get into the information I want to cover today, just a quick announcement. On Thursday, October 4th, I'm doing Conversations with Dr. Pam teleconference call. We're going to talk about confusing research. I'm finding that there is so much information given to people every day about diet and health and medicine, and there's research to back up almost any claim you want to make, and people making a lot of claims know that. So it can be a little confusing to try to figure out who do you listen to and what do you say when somebody brings up a study that seems to refute what you've been telling them about plant-based eating and that sort of thing. So it's at 9 p.m. on October 4th, and we're going to talk about that. And then I'll leave plenty of time for people to ask just general questions about that or anything else they want to talk about. And then on Monday, October 8th, we have a conference call on choosing cancer treatments, and we're going to feature a member who has been through the very difficult task of being diagnosed with cancer and looking at various alternatives to try to figure out what is the best thing for her to do. And if you or anybody you know has been through this, you know that there's a lot of pressure on cancer patients to start treatment right away, and people are frightened, family members are frightened, friends are frightened, and so lots of things to think about and consider when deciding what to do. And so we're going to feature somebody who's been through that process and made some good choices and has a happy story to share, and of course questions will be welcome for that call too. So anyway, as you know, for the last few weeks, few sessions I should say, I've been covering this incredible book by Robert Whittaker called Anatomy of an Epidemic. And some of you might be wondering, why am I spending so much time on this? And the reason is, did you know that more people take drugs for mental and emotional disorders than take drugs for diabetes? And gosh, we do spend a lot of time talking about diabetes. So I don't think there's anybody in the country that isn't affected by this information in one way or another. So last week we were talking about the information Whittaker shared about how patients fare with and without meds, and we applied it to schizophrenia. And so today I want to talk about anxiety and how anxiety actually became labeled as a disease, because let's face it, I don't think there's a human on the planet that doesn't experience some anxiety from time to time. It's normal. It's part of the human condition. But in the 1800s, a doctor decided to call it a disease. He hypothesized that dread and worry and fatigue were a result of tired nerves. And he thought that medicines containing opiates, cocaine, and alcohol would treat the disease. And they were marketed aggressively, and there were actually spas where rich people would go to rest their tired nerves. And I'm almost having trouble keeping a straight face as I share this with you, but this was the way treatment of what was considered anxiety by today's standards was handled. Well, in the midst of all this, Freud showed up, and he introduced the idea that it wasn't neurological, it was actually psychological causes for anxiety. And his hypothesis was that women often developed anxiety as a result of repressed sexual fantasies, and he said that talking and talk therapy would be the solution for that. Well, where this really came in handy is that at the turn of the century, most of the psychiatrists were working in asylums, but over the years, more and more of them went into private practice. And so the idea that talk therapy and repressed sexual fantasies and things of that nature could be considered diseases and talk therapy could be the treatment, that really appealed to psychiatrists in private practice, because almost anybody could qualify for a diagnosis, and talk therapy meant patients had to keep coming back again and again. So it was really good for business. I've always said the psychiatric model is a great marketing model, whatever we think about it in terms of patient care. Another big thing that contributed to anxiety becoming a disease is in 1952, the first edition of the Diagnostic and Statistical Manual, which defined mental illness, came out. And at that time, there were only 5,415 patients in mental institutions, but the medicalizing, if you want to call it that, of so many conditions like anxiety was certain to make that a bigger number. So tranquilizers, after cocaine and alcohol came tranquilizers to treat anxiety. And Milltown, I mentioned that drug in a previous broadcast. It was reported to calm anxious people, but the problem was that it really didn't do any better than placebo in clinical trials. And its use started declining because people would get really, really sick when they tried to withdraw from the drug. And at the time, doctors were reporting that it was highly addictive. It was before the addictive nature of the drugs just became part of the status quo. Other drugs drugs followed, like Valium and Xanax, and they turned out to be just as ineffective and addictive. And the stronger drugs like Valium had incredible withdrawal symptoms that included the onset of anxiety that was so severe that it bordered on panic. Cognitive dysfunction while taking the drug was significant. Amnesia was a significant side effect. And in addition to the anxiety, when people would try to get off the drug, people would experience nightmares, hallucinations, seizures, tremors, blurred vision, ringing in the ears, and the sensation that insects were crawling on their skin. So you can understand why people were concerned about these drugs. And some patients actually never recovered from taking the drugs because they were injured so severely. But as we talked with schizophrenics last week, schizophrenics who don't take drugs do better than those who do. And the same is true with anxiety. When tracking patients who withdrew themselves from the drugs and just dealt with the side effects, those patients do better than those that stay on the drugs. In other words, the drugs like Xanax that are used to treat anxiety make the patients worse, just like all other types of psychiatric drugs. And the longer people take them, the worse that they become. Now, we still have a great number of psychiatrists in this country who are claiming that the reason why people with mental illness are able to live independently is because they take these drugs. Other than that, they would be in the asylums. But I'm going to share with you some statistics that really prove that not to be true. According to the United States Department of Health and Human Services, in 1955, there were 1.66 million patient episodes. And a patient episode is defined as when somebody visits the emergency room, a mental hospital, or other facility for some type of treatment. By 1975, the number had increased to 6.86 million. And during this same time, the number of people determined to be disabled by the federal government increased also. 60 times the number of adults were found to be disabled due to mental illness. But the drugs continued to be prescribed. And the really horrific part of this whole thing is that it is unquestionable in my mind, after reading this book, which I think everybody should read, it's unquestionable in my mind that the reason why people continue to be labeled as disabled is because the drugs actually cause them to suffer such side effects, ranging from cognitive dysfunction to physical side effects, that eventually they can't ever recover. So I think this really sums it up. Whittaker says in the book, quote, "The scientific evidence simply doesn't seem to affect the prescribing habits of many doctors." And of course, this isn't true just for mental health. That happens to be the topic we're covering in this series, but it tends to be true for other conditions too. Now, before I sign off for today, I want to remind everybody that our fall conference, November 2nd through 4th in Columbus, Ohio, features not only some of the great names in plant-based nutrition, like Dr. John McDougall and Dr. Neil Barnard, but Dr. Peter Breggin is coming, who is one of the psychiatrists who was the first to speak out against the biological model for psychiatric care. He's written 20 books on the topic, and so I'm sure that you're all incredibly entertained listening to me tell you about what's in this book, but I think you'll be even more entertained to listen to Dr. Breggin conduct some workshops on this live and in person, and have an opportunity to ask this type of an expert questions about this type of information. So I'll stop here, and on Thursday we're going to talk about depression and how people fare when they take drugs for depression and when they don't. And I'll talk about how depression got to be labeled a disease. So as always, please feel free to send these on to anybody who you think would benefit from listening to these messages. And you're always welcome to email me with your comments at pampopper@msn.com. Have a great day.